Thanks a lot for presentation. As you know, my name is Dr. Knyachnytsky, it's Dr. K. I'm staff psychiatrist at CAMH. My main expertise is in mood and anxiety disorders. I do see a range of populations, mostly adult, but we consider adult to be 16 and up. And lately, I've been seeing a lot of young people, 17, 24, in my practice, which unfortunately coming the vast majority with some sort of addiction problems. Why the addictions are not my direct expertise, but why am I interested in it? Basically for two reasons, because first of all, I'm a psychiatrist. I'm trained in PhD in public health. I'm also a mom. I have a lovely 15-year-old teenage son, so it matters to me what he does in his daily life. So in my presentation, I'll try to touch base briefly on several aspects. So I'm gonna talk about common reasons why teenagers specifically use drugs, and those are not usually reasons they present at the first meeting with psychiatrists or when they discuss that with their peers or parents. I will also talk about effects of use, because it's not common knowledge that people actually know what different substances do to somebody's brain, especially if we talk about teenagers. We will discuss stages of use and why it's important, what's the tolerance, and I will provide a couple of resources you can share with somebody who's seeking for help. So what I want to start with is I want you to think, what do you think people, like most people of teenage age, feel about alcohol and other drugs? What do they usually say? Yeah, it's fine. Oh, we were young. Mom, you've been like that. You drank as well. Sure. Yeah, you've been a student. What else? I'm just having fun with my friends. I hear that a lot. What else?
Advertising.
Yes, Mom, it's everywhere in the media, especially in relation to cannabis. That's natural. That's something like very good. It's organic. Organic is good. Grass-fed is good. Organic is definitely very good. So not a big deal. Fine. What else? What messages do they receive from media?
Fun.
It's fun. It's part of socialization. Absolutely. My friend does it. Your friend did it. You did it. That's what I need to do. Yes?
Also, if they're unhappy, they think they can hide behind it.
Absolutely. Oh, it's so helpful with my pain. I am anxious. I had a joint and now I can do my homework. Mom, it's helping my homework and I can do better at school, right? Everybody wants our kids to do very good at school, right? So that's what they usually hear from media and their friends. And keeping in mind that at this point, media probably is the biggest parent for teenagers, because that's where they got information from. That's where shaping their minds. Of course, they look up to media, they look up to their peers, they try to figure out on their own, because of course they know everything, right? You know nothing when your kids are like 15. You're like zero expertise in anything at all. So that's basically what my 15-year-old comes and tells me. Now, this is some stats, and this stats is based on self-reporting. So in order to understand what is the prevalence of substance use in Canada at this point, keep in mind that it's extremely underreported, because these stats, and it's horrifying, but even that is based exclusively on people who disclosed information through surveys. So as we can see, grades 7 to 12 use alcohol at 39%. Cannabis, 7 to 12, 19.2%, which my 15-year-old said like, Mama, no, that's not the number. It's at least 2.5 times higher than that. Up to 24 years, 88% of alcohol. I can actually bet that it's somewhere probably like 97, 100. Cannabis, 15% of youth from the age of 16 to 24, it's 15% of use of cannabis. At this point, new stats, CAMH just completed like a huge survey study. It's 29. It's 29%. And this is only based on self-reports. Yes, we did very good with inhalants, something which is like clay or like an old school of drugs, and opioids, because they are highly regulated at this point. The face of substances has changed tremendously in the past decade or two. If in the past, when you think about somebody who has addiction problem, you will either picture somebody who's drinking and passing out on the street, or somebody who's doing needles. This is not addiction at this point we see. We see functional people, well-dressed, nicely talking, educated. It's not about people being dumb. It's not about people not knowing what's going on. People know. You have 18-year-old smart A+ student, college, university, doing cannabis on drugs every single day. The rationale behind that, I am an A student, I'm doing fine. There's nothing bad about it. I can handle it. The face of addiction changed and became more hidden, and that's why it's so difficult right now to talk to kids and actually pinpoint that, okay, that's how it's gonna end up. Because at this point, they do feel that it's very helpful. It helps them not to be anxious, it helps them to sleep, it helps them to have fun and socialize. This is a problem. So cannabis, yeah, lovely legislation, companies coming in, we will have a lot of fun. From the public health perspective, of course. So very basic knowledge about cannabis. Cannabis includes two strains, THC and CBD. CBD is a part which does not give high, and it can be, potentially, can be helpful with pain and relaxation. And THC is a part which gets them high. The absolute regular thing I hear in my practice, oh, my mom smoked when they were hippie, they had fun. They smoked every day. Yeah, they did, yeah, probably. And they worked and it was okay. Well, first of all, we have no longitudinal data at this point to actually conclude whether that was okay. We have the largest number of upcoming population with Alzheimer and dementia. Where it's coming from? People were getting like older all the time. We didn't have this number of people with dementia. Was it due to adventurous drug use? We don't know that, right? Is there a possibility? Maybe. The potency of TSH increased tremendously compared to what people had in 1960s. So in 1960s, one joint included 3% of THC, so the part which gets you high. If you go to any dispensary at Queen Street West, it at least has 42 to 48%. If you go with the gel thing, well, yeah, apparently there's a gel thing with that, so you can mix with food and everything. It's 90%. It's 90% of TSH. So it's huge number of percentage. The potency of pot increased significantly. Because it's unregulated substance, it can be mixed and changed in any way they want. Dispensaries are still not regulated. You can't really see what they mixed, how they mixed, and what the percentage of cannabis and CBD in any given joint or cookie or whatever they sell, which also increased tremendously the potential risks to teenage brain. There's a lot in the literature how cannabis is life-saving, it saves people from seizures, it saves people from pain, it saves people from fibromyalgia, it saves people from everything and anything. But if you actually look scientifically into data, and when you talk scientific evidence, we talk about randomized controlled trial, we talk about controlled studies, when you can actually see whether that was a placebo or that was something else. Randomized controlled trials demonstrated only 2 conditions when cannabis actually is effective. And one is MS, when spastic muscle dystrophy, when people cannot move and it's very, very painful, and spastic paraparesis. That's it. Only 2. The rest is, let's say, there's no robust evidence that it's actually help. There's a new study at CAMH when they looked into this perception that, okay, it helps me with anxiety, it helps me with pain. And it's done by one of the leading physicians at CAMH in addictions by Dr. Tony George. So Dr. Tony George, he demonstrated that it's not actually helpful with anxiety. What people do, they go through withdrawal because, yeah, cannabis gives withdrawal. People don't believe that, but it actually gives very clear medical withdrawal. So he demonstrated that when people say, oh, it's helpful with anxiety, same with alcohol, you treat withdrawal symptoms from cannabis or from alcohol by cannabis and alcohol. And in this case, yeah, it's helpful with anxiety. But if you actually, in a controlled environment, force people to be abstained for 14 days, they stop being anxious all of a sudden. Very interesting. And they don't need cannabis. This study will be published soon. Very interesting. I think it's going to make a lot of stir in the media and medical community. Alcohol, very cultural, especially in Ukrainian culture, right? It's part of everything and anything. I've been on Yuki Festival. Our young population is fun at Yuki Festival. People start using alcohol at the younger age. They start using so-called light drinks when they're mixed with some sort of cola or Red Bull, some energetic drinks, which actually biologically it intensifies alcohol toxic effect on the brain. But because they're perceived as light drinks compared to vodka or something like 40 and up %, there is an understanding in the community that you can do that, that's okay, that's fun, it's a light drink. There's nothing bad about it. Same with beer. There's a very clear beer alcohol dependency, especially in Ukrainian community, because beer usually is perceived as sort of like a compote, because it's very light, right? Like it's not vodka. You can just use it, not a big deal. What it unfortunately results in liver damage, and if there is a liver damage with time, you don't need to drink much, because your liver is not processing. Liver is our hub to get our toxins out of our system. This is our cleanser. And if cleanser does not work, then we will start having all other issues. Depression, because depression is biological. It's very tied to endocrinology. Anxiety, because of the same reason. Tiredness, exhaustion, cognitive impairment, because liver damage results in alcohol dementia. People who drink on daily basis, over safety guidelines, 5 times higher to get liver damage. Other substances, opioids, and here, especially in Canada, and in the latest trend, we're talking more so about Oxy, Percocet, Tylenol 3. So it's widely prescribed for people with pain, and kids do tend to borrow medications from their parents. Gets you high, they feel great, they feel euphoric, nice. It's widely available, especially within the party culture. When you go to a club, you offer it often something like that. Probably the lowest number of people coming with full opioid dependency, especially teens with opioid dependency in Canada, will be with opioid because you catch them faster. The majority of people will exhibit some sort of behavioral aggression or erratic behavior or bizarre behavior. And in this case, for clinicians, it's easier to catch up. It's not that easy to do with both cannabis and alcohol. It's almost impossible to do with cannabis at this point because they will not come when they use on a daily basis. They will come when cannabis will result in psychosis. They will come when cannabis will result in severe depression, insomnia. And that's sometimes a bit too late, or it requires much more work at that point. So why people use? I've heard a lot of stuff. They're dumb, lazy, lazy a lot. This is their choice. They want to use. They just want to have fun. They're weak. They're very, very weak. They can just pull up their socks and just get rid of it. Go for it. This is what I would hear at practice, especially people who are using cannabis and alcohol. It helps me sleep. It helps me not to feel sad. It helps my anxiety. Levels of anxiety in teenagers in a group of 16 to 19-year-old at this point are 50% more than in schizophrenia patient in 1950. And that was schizophrenia patient. Levels of anxiety are horrendous. And they don't know what to do with that. They have school, they have to do their work, their expectations, they have their chores, then they have peer pressure, then they have devices. There's a lot going on in the head of a 16-year-old, a lot. By default, I haven't seen anybody of this group age who would not report some sort of anxiety issues. Yes, and it helps greatly with anxiety. They can sleep on it. And it's so nice, they feel relaxed, they feel very good. I think when we talk about substances with teenagers, we talk about how bad it is, how difficult it's gonna be, how you're gonna die and you will end up on the street and you will be homeless. But we forget that there is a good side to it, and this is why they're using it. And if we're not gonna be acknowledging this side, that yes, it does help you with anxiety, and I understand that. Yes, I can see that. We also need to acknowledge goods in their perception to be able to talk about bads. The absolute majority of people who use substances, what we call misused, which means that they use them at least on a daily basis, once or twice per day, with no breaks. That's misuse. Heavy use when they're using substances every single day, a couple of times per day, and there's no break in a week. So they use this on a consistent basis. Because of the high level of anxieties, because of high level of mood dysregulation, teenage brain is not developed by the age of 27. It's just not there at all. So they're being snippy and irritable and shouting and knocking doors and I hate you, screaming. That's because they're literally prefrontal lobes, they're not developed. That's where our executive functioning is. That's what our brain does when we need to stop something. This does not exist in somebody who's not 27. It just doesn't. So for them to go through this number of intense emotions, they have no tools what to do with that. They want to numb, they want to escape, and usually they escape sadness, depression, anxiety. A lot of people at this age specifically, they go through gender questioning, and when it's difficult for them to disclose and to discuss, they will be discussing with peers, or if they don't have a proper peer group, they will be using substances because it's very difficult to sit with emotions. And of course, some will do because of the friends. It's peer pressure. If this is the only group person has, person will stick to this group. At this age, yes, peers are more important than family. When they have not much to do outside of their daily routine, like going to school, going to activities, going somewhere else, they will be relying on their family group. And stopping substance will require them completely give up their friends, because that's exactly what usually happens. As soon as they decide to recover and stop, they start being uninterested. Like their peer group is not interested in being around these people, and they lose it. So if somebody was very isolated and had a peer group and where everybody was using, but they had those people, and they didn't feel so isolated. When, as parents, as physicians, as medical professionals, we pull them out and saying like, okay, now let's do this amazing thing and you will not be addicted and your life will be wonderful, which may not be actually true. They're losing their peer friends and they become even more isolated. And I think this is also something we don't talk often about, and we need to address support network, and we need to have a healthy substitution before we take something away. That's my favorite one. Cannabis doesn't do anything. It doesn't affect brain. I've been smoking from the age of 12. I'm successful. Executive, base trait, right? Suit, looks nice. Yeah, successful, no doubt. There's very clear research on how cannabis use affects cognitions. Memory, concentration, and learning. There is a disruption with learning memory. There is a disruption in ability to gain and retain new information. Lung disease, yeah, but like teenagers, they don't really care about the lungs, like not even slightest ever. Judgment and decision making. That's what we care about, right, as parents, because they may engage in very risky behaviors. They may regret those behaviors down the road, but sometimes it can be too late. What I do care most about as a psychiatrist, that people who misuse cannabis, and again, misuse is just daily use, is have a joint, it's misuse. People like that are 4 times higher risk of depression after 18. And those people which I will be seeing a lot, because they will come depressed, and unfortunately medications not necessarily able to achieve robust response. Because if we think about somebody who's been using cannabis from the age of 12, and that's when they usually start. So 12, 14, 16, they're using every day for 6 years. On a brain which hasn't been developed yet. In this population, it will increase the risk of depression tremendously. And it's not much medically speaking, like pharmacologically speaking, you can get to this brain. If the brain hasn't developed particular number of neurotransmitters, it will be very difficult to redevelop them somehow with any type of medication. There's only that much resources in brain. And when they don't exist to begin with, you will be left, we are left, to work with whatever is in there. And sometimes it's not much, unfortunately. And this is population which I will see very often in my practice, 22, 35, 46. Eventually they will need some sort of social assistance, ODSP, OW. They have difficulties holding a job. They have difficulties staying with the family. So it's not just affecting that one person who was using. It affects everybody around, and it also affects system in general. The level of mental illnesses skyrocketed like 6 times in the past decade, and it will continue to grow. And it will continue to grow on a very steady trajectory with not much we have. Pharmacologically speaking, in psychiatry, there have been no really new interventions, well, except of brain stimulation, of course, thanks to Temerty family as well. But the last medication, new medication, which was developed was 40 years ago. Nothing after that was developed. That's it. And now we have full new population coming in. We have no idea what to do next. System on its own, unfortunately, tends to be pretty reactive instead of being proactive. And I feel we need to talk to kids explaining that, yes, that it's helpful with this part of you, of what you're feeling right now, but that's what it's going to be in the future. Let's sit and talk whether that's actually what you want to have. It actually increases feeling of loneliness or not fitting in or feeling very different. It increases irritability and anxiety. That's why they need to smoke next day. Not because they're anxious, but because they're in withdrawal and they need to treat withdrawal with another joint. But their peers will be saying, oh, that's because you're anxious and you should smoke and it's going to help, which never does. So brain does not develop until mid-20s. It actually stops and changes structurally the development of the brain. Especially it changes part of the brain which are responsible for executive functioning, being an adult, analytical processing, and memory. So their ability to perceive environment changes tremendously. A lot of would be needy, emotionally sensitive, with very fluctuation, like with very drastic fluctuation in mood, drastic fluctuation in behaviors, because the substance covers up and doesn't allow them to grow and learn something else. What we will have down the road is somebody who will be unregulated. They don't know what to do with their emotions, they have no idea what to do with their actions. The use usually comes on continuum. Everybody drinks, we all enjoy drinks and Christmas, summertime, social gatherings, sure. Experimental use is pretty normal in teenagers. They need to know how to use it so they don't overdo it down the road. Use occasionally, so anywhere we're going in this pyramid to regular use, it's fine till we hit abuse. The issue with teenagers that as adult, for us to go from non-using to abuse, it's going to take 8 to 10 years. For teenagers, because nothing is developed in those lobes, it's going to take 3 to 15 months. It's rapid. So from non-user to dependency, it literally can take 3 months. And this is a problem. What goes up must go down, always. No exceptions. The high people looking for, this euphoria and feeling that I can do anything, I'm the best and everything gonna work. This will go down, really down, and people, which they usually say, they're gonna crash. Really, really crash. Using substances is an escape. Life is stressful, school is stressful, being popular is stressful, being not popular even more stressful, being bullied is stressful, having girlfriend is horribly stressful, not having girlfriend is even double horribly stressful. Life of teenager is horrible because they have hormonal changes, they have no idea what's going on with their bodies, they're moody, they cry, then they laugh, then they cry again, then they're irritable. Like, with no reason, like at all. You just like watch outside and I'm like, what the heck just happened? So for them, because we as adults, hopefully, the majority of us, not all of us, we learn how to deal with these stressors. When we grew up, we had no devices. We were just like left on our own. If you cry, you sort of cry, but then you're fine. Like we learn how to deal with emotions. They don't, and they didn't. They will try to cope with drugs, but what they will not do, they will not learn how to do this differently. They will grow into emotionally immature people who will continue doing that down the road as adults. And those adults will be those who saying that, okay, using not a big deal. I was successful, I did that. But they will still continue feeling those feelings. And I think as family, as community, where we can be successful and where we can help, we can try to help them to learn how to deal with emotions and anxiety, how to soothe themselves in a healthy way, how to channel these emotions in a different level. What usually happens, of course, if they use on a daily basis and that's consistent use, that they will develop tolerance and they will need more because it's never going to be enough. This is just a bit of evidence, especially lately, because of all understanding of how cannabis doesn't result in anything and it's organic and it's all good. So those are randomized controlled trials we have at this point in psychiatry, which are looking into comorbidities between psychiatric conditions and substances. Lines in red demonstrate causation. So something which actually been proved, like really proved, that it has an impact. So if you can see, schizophrenia, major depression are tied to cannabis. They also tied to tobacco use. But cannabis, both of them. Those are two major psychiatric conditions we're dealing right now. The first psychosis episode, onset of schizophrenia, or any onset of any psychosis, which is age 16 to 18, probably 98% are based on heavy cannabis use. People don't come with psychosis just as previously when I went to med school and I saw psychotic patients out of nowhere. 99% those who were using heavily resulted in psychosis. The yellow links is like not very strong linkage, but blue lines somewhat like moderately strong linkage, which again, as you can see, goes to cannabis with everything. And alcohol, of course. Cocaine, not so much currently, well, at least not in teenage population because of the costs, but the rest is pretty common. And I think that's it. So if you have teenagers and they are on Netflix, as mine, there's a very good series on Netflix, How Drugs Work. Very well done, very scientifically driven, with actual explanation how brain works and what it does to somebody's brain. I really encourage to share and to see just for yourself, because it's fascinating how little we know about what it does to our brain. And if you want to ask a question, if you want to pose a question, you don't need to do that here. You don't need to write. You're free to email, and I will be happy to respond to questions. Thank you. Thank you. Yes?
I know your field of expertise is teenage, but is there anything you can shed a light on seniors who become addicted to prescription drugs later on, probably teetotalers through their whole life or moderate with alcohol, but are they more susceptible because of age of becoming addicted, or it's...
It's a very good question. So I think,
Because
yeah.
of brain development or brain deterioration?
Or both, right? Very good question. So I think in geriatric population, at this point, it's less so about cannabis and alcohol, but it's more so about opioids, painkillers, and benzodiazepines, clonazepam, lorazepam. Lovely combination. I think initially people get into habit because they try to actually treat symptoms which are concerning to them. Insomnia, people don't sleep, and this is a big, huge issue. When they don't sleep, they get irritated, they feel exhausted, they feel very tired, right? So they need to take a pill. So geriatric population is more prone to be on benzodiazepines and painkillers. And it does changes brain. It changes cortical inhibition. Cortical inhibition is something in the brain which gets our brain plastic or not plastic. And when you think about plasticity of the brain is plastic, it's able to sustain stressors. It's like being very flexible with your body. When body is stiff, it's not like you can do much. So same is happening with somebody's brain, especially like older population. If brain is bumped with opioids and and benzodiazepines, it becomes less plastic. And if it's less plastic, it's difficult for brain to sustain stressors.
So it's a vicious circle then?
Yes, exactly. So you take a pill to make it better. Then it's never better, then you take a pill again. Yes?
What are your thoughts on the possible effects of the government's legalization in 8 months of cannabis?
I think this is a very interesting time we're living in. I'm very looking forward to see what's going to happen in 10, 15 years. I think we can't really actually know. If I'm pro legalization in a sense that in my understanding, it was supposed to address regulation. So it's supposed to limit access. And in this case, I'm for it. So I don't want any drugs to be available widely as they are at this now. That said, alcohol is very legal as well. Painkillers are extremely legal as well. It doesn't mean that they are not harmful. I think when there is a legalization, I'm a physician and I'm a public health professional, so I'm not a politician. There is a very clear political rationale why. I think before we can conclude that it's effective campaign, and it's not effective campaign, we need to have resources in public. My concern is about most vulnerable population. And I'm not sure that at this point we have enough of resources for this vulnerable population. And my fear that, it's going to be perfectly fine for a subset of population. But again, this is not people I work with. And I do concern about my patients and how they will handle it and how access will change number of addictions. There are some positive developments over the globe, let's say Portugal, the legalization decreased level of addictions over 67%. There's also some other developments such as Denver, where it's also was legalized. And yes, it decreased number of addictions. However, in a population grade 7-12, it actually increased use. So it's a very complicated question with an equally complicated answer. I think it can be politically beneficial. As a public health professional, I want to see how it will affect population. At this point, unfortunately, we're not collecting any data. We have no baseline assessment. To be able to conclude that, okay, it's effective or not, you need to know where you start. And at this point, politicians do not allow us collect baseline data yet. So it will be difficult for researchers to actually being able to conclude any evidence whatsoever.
And you cannot make intelligent decisions in the future without the baseline facts to start with. You and I You and I know the political
Yes.
situation that you face.
Yes. It's very difficult to draw any conclusions when you don't have data. And if you don't have it, how can you conclude anything at all?
This isn't so much a question for me, it's an observation. Anxiety in our society, especially amongst children, grade 1 and onward, and then preteen and teen is, as you say, it's epidemic. And I see, I'm not an educator, but I have some involvement. I see some of the causes of this in an environment, an education environment, that is high stress, high anxiety to begin with. We have children who aren't focused just on learning what we used to refer as the 3 R's. There's a great deal of attention being placed on environment and other cloudy, thunderstorm issues that cloud their day, and that's what their discussion that you overhear at lunch or at McDonald's or at dinner time around dinner table settles on. It's not how they did playing baseball or other play activities, which there isn't enough of as well to reduce. And how do we change that in order that there isn't the drive to peers, because peers don't have the answers, and the drive to the substance to mask or
Right.
hide behind.
I agree, absolutely agree. We don't teach them strategies what to do with their anxiety at all. But let's say, like my son was going to public school, Runnymede Public School. They cut down musical sport programs. CAMH, the MRT Center, just published amazing research how music changes cortical and brain and how it decreases anxiety, which is like, it's very simple. It's very simple. We've been there, we knew that, and now we have evidence, but we continue cutting programs which we don't feel as valuable, because you need to be science, right? Like you need to have science to get to university, and math and physics and blah, blah, blah. And the rest is not so important, which actually it is, because it socializes them in a different way. So I think that's more so like structural issue. It's about what we see as valued and what we see as less valued as a society in general. BA in arts and bachelor in science definitely has different perspectives in life. So I do agree, absolutely. We need to do so much better.
And just to facilitate the discussion, I'm going to go in the order that I saw. So
Yes, Dr. Reva.
We have a question here, then we have a question there.
So I have 2 questions I'd like to ask you. One is going back a little bit more to basics. Is there a society that you're aware of in the world that doesn't, and we're not talking about kids here, we're talking about the adult population, that doesn't use some kind of chemical agent to help them cope with the anxiety of life? Is there anybody living a drug-free existence on this planet?
Very good question. I adore Switzerland system in every single aspect of it. Healthcare, education, what they do for kids, how they raise kids, and how they promote healthy lifestyle, no additions. Well, of course, probably they also do a lot of substances in there, and substances are part of our life. There's no way around. But I think with behavioral, and that's what evidence also shows, with behavioral interventions, you can achieve so much more. Cognitive behavioral therapy, interpersonal therapy, supportive therapy, recreational aspects, they all very, very effective for anxiety. We just don't use them very often because, first of all, we don't have money for it, right? So funding is not there because funding is in pharmaceuticals. It's easy. Yeah, you just come to see your GP, you're 18, you're stressed out, here's your lorazepam, and you go. CBT takes 16 weeks, 16 to 8. It requires trained clinician. It requires highly trained and paid clinician, space, and work. It's tough. Lorazepam is so much easier. As a society, we are looking for a very fast fix. We forgot how not to do fast fixes and put some work into that, right? And that's actually can be very helpful. That's exactly what Switzerland is doing. They incorporated CBT techniques in their kindergartens. They teach kids, oh, you're anxious, you need to recognize your emotion, you need to work with your emotion, you need to go and have like a quiet time so you can soothe yourself on your own without anything at all. Of course, because the country is very small, it's so much easier for them to implement those strategies. I'm not sure how that's possible in Canada with the diversity and large territories and everything. But I think there's still some room for improvement for that.
Can I ask you the second question?
Yep.
Thank you for the answer to the first one. Access. So for the people in the room here, somebody has come to their attention that they're having problems coping with the stresses of life, and they're abusing the drugs, abusing alcohol, whatever. What is the access to get somewhere in Ontario?
Very good question. Thank you. Painful question. For addiction specifically, CAMH develops strategy which is called Fast Track. So if you call a number, you press extension 2. They literally will give you a call within 72 hours back. The programs available are, like we have numerous programs available for teens, for women, for men, for legal involvement. They try to assess and offer treatment within 72 hours. It's pretty accessible. It's very well funded at this point. Because of another thing, because province just allocated enormous amount of money for CBT, cognitive behavioral therapy. There are 4 hospitals where this funding will be available. CAMH is one. Ontario Shores is the second one. Waypoint, something else. But those 3 major hospitals. So CBT, cognitive behavioral therapy, before the wait list was up to 12 months. The new expectation that it's not going to be over 6 to 8 weeks. CAMH hired 9 new therapists to make it more available. So province recognizes that there is a problem and we need to do something with that. The process of referrals is streamlined, and at this point, people, at least for mood and anxiety, people don't wait over 3 months to be seen by a psychiatrist. So that's something definitely should consider, and there are a lot of resources available in the community for addictions and drugs, if person is willing to accept help, of course.
Thank you for presenting such good information on addiction. Addiction is a universal problem. It's not only for these intelligent people, a group of intelligent few. I have the problem in Canada, where doctors prescribe addictive drugs. The government is in promoting addiction. They're importing by the tons of years. And to leave everything to an individual to know all about it, to stop, whether it's alcohol or any other drugs. It's just too much to expect from those who are already addicted. And so, when we're talking about a government which makes billions on drugs, in fact on addiction, so they're promoting addiction. And then we're talking simple information about effect of alcohol, tobacco, or opioids, or any addictive drug. There is a very good article in National Geographic, scientific article on why our brain becomes addictive. I suggest those who read National Geographic to read about it. It's very interesting in our last month issue. So I don't know how can you or anyone else fight the government, which in fact promotes addiction. Thank you.
Thank you very much. I think I agree with every single word you said, absolutely. Yes, there are a lot of physicians who continue to prescribe addictive substances, oxy, pain, benzodiazepines, like the huge one, for psychiatry at least. And I think a lot of them will continue to do that, because some physicians come to profession to be altruistic and help. Some physicians come to profession with a different reason. It's been like that a lot of time. It never changed, and I think unfortunately will continue like that for some. There's also a very strong movement within physicians trying to address exactly that, trying to demonstrate and get whatever data we can so we can prove that this is not helpful. But for us to be able to prove how a substance works, what kind of effect it has, and where it's helpful or not, we have to have data. We need to have research. We have to do studies. We have to demonstrate the evidence. Because as a physician group, you come to a province and saying like, okay, this is not the best way how we're supposed to do that. Where's the evidence? The evidence hasn't been accumulated yet. It doesn't mean that substances are not harmful. It just means that to do one type of research takes at least 3 to 5 years. You need to apply for protocol, you need to do ethics committee, you need to execute research, you need to analyze research, and then you need to publish. So this is just because we don't have enough data yet, but this is what CAMH is working on. CAMH will have first cannabis clinic. There's no other cannabis clinic in Canada exists at this point. It's going to be led by Tony George, Dr. Tony George, who's a leading addiction psychiatrist. And this is clinic actually to help those with addictions, not to dispense, to help those with addictions. The public health physicians who are also dealing with the campaign and trying to minimize the damage, I guess, at this point. They're also very vocal that before any legalization and before making it very open, we need to have very, very strong system to protect those who are vulnerable. There will be a subset of population where it's not going to be an issue ever. But there will be a very strong subset of population where it's going to be a huge issue. And where we need to do something to put some brakes to promote and regulate. My hope, if it's regulated in the right way, that's how we can lobby to the government, that you need to restrict access, not to widely open access. Is that going to happen? I don't know. I'm looking forward to it.
I have a couple more questions. Number one, I mean, I find it mind-boggling that doctors would not know that an opioid is addictive when for centuries the Chinese have had their opium pipes and opium dens and Bacchus in ancient Rome and whatever. So, I mean, these substances have been around for thousands of years. So it's, to me, it's almost hypocritical that how it's dispensed and then how it's now treated. But that's an aside, that's a comment. 2 questions. My cousin was dying of a brain tumor, and he was given, I guess morphine wasn't helping or whatever. He was given cannabis oil to make a tea. Now, you stated that it only helps in paralysis and people with MS.
Proven evidence.
Proven evidence. So was that just to placate him?
Well, I don't, to comment on medical case, I can't really comment on medical case because I don't know the full history behind, right? So can it be helpful in some cases? Absolutely. But those are what we call anecdotal evidence. It helped one. Did it help the rest 100 people? We don't know. Getting back a bit on your question about doctors knowing or not knowing, it also depends on marketing campaign actually. When fentanyl came first in Canada, it was marketed specifically, and this is not my psychiatric background, that's my public health social science background, PhD. It was marketed to emergency docs. It was marketed in a way to help. Because what was going on at emergency departments before fentanyl came to place, you had to prescribe morphine several times per day, because it wore off, of course. So, and sometimes you overdo doses like significantly. The marketing went that you can use 1 dose, and there's no side effects, and you don't have to prescribe only 4 to 6 hours, and it's going to be great. There is an amazing article which actually looks in a historical aspect of how fentanyl came to the market. And it was marketed specifically as a safer option. Do you know that it's addictive? Of course. But when you're making choices, and choices in medicine, they're never easy, they're never black and white. When you make a choice, you try to choose something which the least harm and the biggest benefit. Sometimes it backfires, like really big time.
And doctors, well, just my opinion that doctors don't cure, they deal in percentages of outcomes. But anyway, also I have an issue with this, and it's very interesting because I think Wi-Fi and I think the internet is a drug, and when I see toddlers in a restaurant being plugged in with their little tablets and being antisocial already to placate them, which I think a lot of this thing is parenting myself. But I think Wi-Fi, and just your take on this, I think I think the spike in autism has come from that.
Well, I can say that there's no evidence to demonstrate that at any level at this point ever existed. The role of devices and role of internet and the media and connection through media is definitely a very hot topic, especially in child and youth psychiatry. As it probably was back then when the new TV came, like the new horrible thing came on, and it was called TV, and parents were terrified because people are just going to stop going outside and socializing. I think as with everything, it may have good and bad. And if they sit on meaningless games, yes, of course it may affect. But media also able to offer a lot of very good, very high quality educational programming for kids. When they use media and they use devices, the development of the brain is different. They use different areas of the brain. Same as when we watch TV, same when we read a book. Is that good or bad? It's different. Their communication, their skills, their perception, their processing of information in kids 14 to 16 is very, very different. They text with short sentences. They never, like my 15-year-old never writes me a paragraph. He texts us with sentences because that's how cognitively they convey messages at this point. It can be harmful, or it can be complete opposite. It can be, they are creative. kids who learn through medias from the very early stage, they are extremely creative. They can do stuff I never even thought about doing that. They use different areas. They perceive things differently. It can get an addiction as well. Again, for sure. Of course it can. But not necessarily. Before taking next question, I want to ask the one I've got on my slip.
Thank you.
Sure, thank you. So what to do, it's about access and what to do. If you have a loved one you suspect who's suffering from addictions or you want to find help, my first recommendation will be to contact CAMH. Well, of course, I'm biased. I'm like media CAMH right now. But anyway, because we do have resources. And if we don't have something, we will be able to direct. Number, extension 2, those are access to addictions. There's a variety of interventions offered. Sometimes it can be inpatient. Very commonly it's outpatient. It can be a combination of very intensive programming, outpatient and medications. It depends on severity. It depends on what person is looking for. It depends on what person is committed to do. CAMH offers, it's OHIP covered, of course, it's free. There are a lot of different organizations, such as residential settings, such as Bellwood. They do, like you need to pay in Bellwood. Homewood, you also need to pay at Homewood for addiction services. At the first line of access, I actually would recommend CAMH. And because then it's easier to get from there. Of course, person needs to be willing to accept help. They don't have to agree at all. We use harm reduction, motivational interviewing. It's not like somebody comes like, okay, you need to stop like now. It never happens. It's unrealistic. We work with people to get them to a particular place. And yes, sometimes it takes a long time for somebody to recover. But asking for help is the first step, and I think it's very important to ask for help.
Okay, my question is there a certain segment of society based on social economic sort of distinctions that you have seen in the past few years dramatically increase in teen addiction? And I had a second question, I can't remember.
Let me ask you this one. Yeah, and then you can probably like the second one. You know, it's a very interesting question because initially I would think that yes, like immigrants, minority, like people who are going through a lot of hard time. But no. It's very consistent across. Yes, people who are immigrants and coming to a new country and a lot of difficulty settlement, they may be more in risk. But people I see in practice, private schools, amazing parents, very secure environment.
No boundaries.
No.
Okay, now I remembered my second question. A lot. The baby boomers, you know, were quite thriving in the 60s and so on. You know, and I'm sure a number of them have experimented with the various options that you were talking about. With the new law coming in 8 months' time, do you foresee that there will be increase of use of cannabis for these baby boomers?
That's an interesting question.
Availability. I don't think people will go and hang out around the school looking to buy something. But, you know, it will be available, let's put it this way. And with that, do you think there will be an increase? And if so, what could be the consequences?
You know what? I have never actually thought about life from this perspective. That's very interesting. Well, maybe because the potency of pot's so different, they may not like it anymore. Because the stuff they used like in 60s was like 3%, and now it's 48. I don't think they're actually gonna like it because they may feel like drowsy and sleepy and dumb and sluggish and nothing is really working. But they're gonna be a couple of people who may be using that. I think those who have been using from that time, they will continue to use. I don't really think that the population which was like clean and not using, all of a sudden gonna jump in another spur of using cannabis. But yeah, I know. I actually don't know. We will see. So geriatric population is huge, so we will see.
Can I ask for clarification of what you just posted on the screen there? In the order of addictions, KMH is willing to look at, I imagine, opioids, is willing to look at cannabis you just mentioned. Something much more widespread, say alcohol. Is KMH willing to look at alcohol addiction?
Yeah, we have actually special programming at this point. It's called Da Vinci Project. It's for people with alcohol addiction and depression. Because unfortunately what happens in psychiatry, let's say if I see somebody with depression and alcohol, I can't do much because you need to stop drinking and then I need to figure out whether you're actually depressed, which a lot of times turn out not really. We do have now a specialized program for people with depression and alcohol. We have a lot of alcohol-only programming, including for women with trauma. Women with trauma, PTSD, borderline personality, self-cut, because that's another huge issue right now in Canada, self-harming behaviors in females. So absolutely yes. So it's alcohol, opioids, benzos, and painkillers.
And if we go to the next level, we go to smoking. Does KMH handle smoking addiction?
We have, yes, but at this point it looks like almost nobody smokes in Toronto and in Canada. But yeah, we do have nicotine clinic. It's college and university. So they do CBT, they do those like patches, they also prescribe medication. But it has been like less popular compared to everything else. Because I think they did a great job. Like they actually did amazing smoking campaign strategy in general, so people do smoke less at this point.
Because smoking has been made socially unacceptable.
Yeah.
That's a different approach than to the other thing, which is still being marketed. Smoking is, the approach to smoking has been a societal approach.
Yes.
Let's make this something that nice people don't do, and hence that has cut it down.
Exactly, and I think if we would have something like that, smoking campaign is tremendously successful in Canada. And I think we should have the same with alcohol and cannabis. It should not be fancy to smoke. And in this case, as a society, so the smoking campaign actually included strategies and changes on all levels: provincial, governmental, societal, medical, public health, schools. Like it was a very broad approach, which unfortunately we don't have yet with cannabis and alcohol. Somewhat with alcohol, but not so much with cannabis.
First of all, thank you very much for the really tremendous lecture. Really enjoyed the discussion. Question for you: some of the approaches that I've heard concerning, for example, alcohol addiction, is that the person must be willing, must be ready, it must have come to that point. I mean, hit rock bottom before they can climb up. Is that an approach which is actually feasible in the case of a teenager, for example, who is using cannabis? What would your advice be for concerned family, friends, who are looking at a teenager and suspect that they have, or have seen evidence that they have an issue with substance abuse?
Thank you. I think it's probably one of the most difficult questions. I don't feel that you need to wait till the person hits rock bottom. There is a school like that in psychiatry and addictions. It's Johnson intervention. You need to completely tear yourself apart before we will create something else. It may work for some people. It doesn't work for everybody. So in this case, I feel that family and surrounding is very important in encouraging somebody to ask for help. You can, of course, you cannot drug person without person's permission, but you always can have a conversation. And in motivational interviewing, it's called pre-contemplation phase. When people don't see this as a problem, when they don't want to see that this is a problem. So what you do in pre-contemplation stage, you provide the factual information. Okay, you don't see that this is a problem. You didn't go to school, your grades are low, you're isolated, you're spending all day at home. How do you feel about it? Open conversation. Because what's difficult for parents, I'm a parent, 15-year-old, all lovely stuff. We tend to start being judgmental because we want to help. It's so easy just like, to drag them, put them somewhere, treat him. It's very difficult to sit and discuss topics like that because they will require you not to be judgmental and hear what they want to say. Just listen to what they want to say. And eventually you can pick up on things and you can provide information like, oh, okay, so you think that everything is fine. Let's talk. That's what I observed, A, B, C, D. What do you think? Oh, I was just tired. Oh, everybody does it. Well, that's how you've been last year. What do you think? Maybe we should just go and talk to somebody. So you're not pushing, let's go and see because you're addict, like you're sick. Let's go and talk. I see you struggle. I see you anxious. I see you're not doing well. And I want to help you because I love you. I'm your mom, I'm your dad. I'm not able to help you, but let's go see a professional. Let's just talk. And when you open a conversation to talk, they may be more willing, at least, to go and see a professional. I had a couple of kids coming and being very, well, of course, like oppositional. Такі малесенькі їжачки, very їжачки. Але коли ти, if you talk, if you sit, if you listen, at the end it was like, okay, yeah, I'll go see a counselor, fine. I'm gonna do it, fine. And this is the first step. If they, at least in their head, acknowledge that there is a possibility that something may be not very wrong, it's not like you're going to go see a counselor to address your addiction. No, but you're doing this for something. You're either coping with anxiety, you're either coping with emotions, you lost your girlfriend, you lost your boyfriend, somebody call your name. They are coping with something. And that's where you can say, like, okay, let's go get help for that.
Any other questions?
Дуже дякую.